If you look at the AP of this lady, you can see there is an obvious loss of joint space here. It looks abnormal, so this is translated laterally. And if I show you the lateral, it shows a clear dorsal dislocation of proximal interphalangeal joint. Now, how to reduce it? Now, there are two ways that most people will do is one will be to apply a longitudinal traction here, but I try to refrain from applying longitudinal traction because sometimes it can convert a simple dislocation into a complex dislocation. That means soft tissue interposition in form of volar plate, which is not there. If you just give a longitudinal traction across this line, it can convert them into a complex dislocation. So what I do is, if I draw an arrow here, I would push this back with my hand, and then with other hand I will try to reduce it, and I will explain it again when I am doing the reduction maneuver. So I have just drawn this for you. This is our P1, this is P2, this is P3, this is dorsal, this is volar, and this is how the dislocation is. So what I am going to do is, I am going to use my thumb here to push this back, and with the other hand I will reduce it rather than just pulling it. So I will demonstrate it again when I am reducing it. So my thumb will apply this force, and with the other hand I am just going to pull it and reduce it back to its original position. So what I am going to do is, I am not going to pull like this because if you are lucky you may reduce it. If not, then you can make it a simple dislocation into a complex one. So that is what I am saying, don't just longitudinally pull it. So what I am going to do is, we have already given some ring block so that she doesn't experience a lot of pain. With my thumb I am pushing the head of the proximal phalanx back. So I am just pushing the head back, and with the other hand I am just going to apply longitudinal traction and then reduce it, and this is all done. So you can see she can start moving this normally. So you can see now this is bending completely. She is moving the hand quite normally and the pain is much better. So my message is that don't give longitudinal traction. So push this, push the head back, and the other hand reduce it. You will hear a click, and then your reduction will be much easier. So she can make a fist. So this is how you reduce a dislocated proximal interphalangeal joint of a finger. So once you have reduced the fracture, dislocation, it's mandatory that you take a check X-ray to make sure that you have managed to reduce it and your reduction is congruent both in AP and lateral plane. So if you see here, it looks pretty good, and here it looks pretty good. So after you are happy, then you need to apply buddy strapping for around 3 weeks, but you can get the patient moving her hand pretty much straight away after the reduction. So this is the same lady. We have applied a buddy strapping, but she can start moving the hand pretty much straight away, and the pain or symptoms are almost completely gone.